Hi, hello everyone. Thanks for joining us today. It's my pleasure to welcome you to the launch of our report on digital health in primary healthcare, focusing on the current use and future opportunities in the Sub-Saharan Africa region. So I'd like to start by saying that this report was developed by the Institute of Global Health Innovation in a close collaboration with the Afro PHC and with the Global Digital Health Unit at Imperial. And the first thing that I also wanted to say is also to thank all the individuals that have contributed to this report through their interviews and attendance at the roundtable, and that have provided invaluable insights that ended up in the production of this report. So as you all know, digital technology is well placed to become a powerful tool supporting primary healthcare worldwide. And as this paper shows, digital technologies are nowadays used widely across the African continent to deliver health services and address long-standing health system challenges. We have involved a diverse range of stakeholders like governments, healthcare providers, non-governmental organizations, and brought them together to think about how can we develop innovative digital solutions and broaden their application. As these efforts scale up, we must keep in mind of the main aim and the main goal of innovation, which is thinking about our patients, maximize patient benefit, and provide equitable, safe, and high-quality care as a beacon for the future development and best practice. This piece aims to provide a synthesis of the current evidence and thought leadership in one place, but we acknowledge that there are many questions that need further research and inquiry. We know that this is a first step, and there's so much more for us to do. So we hope that this sparks a comprehensive, ongoing discussions about the future of digital health. We know that there's a need for a more comprehensive, inclusive, and diverse overview. And we hope that these conversations actually start new partnerships so that we can together think about the lessons moving forward, not only for low and middle income countries, but also how us together, globally, as a community, can learn from each other and work together. I would like to thank you all for being here with us today. We will move into a presentation by the first author of the report, which is Niki O'Brien, Policy Fellow at the Institute of Global Health Innovation, and she will kindly share with us a summary of the main findings of our report. Over to you, Niki.
Great. Thanks, Anna. And thank you again, everyone who's joining us this afternoon, and to everyone who contributed in this really exciting and interesting report that we have been working on since last year. I'm going to go relatively quickly through our report findings, just so we can get to the real heart of our session today, which is to hear from individuals from across Sub-Saharan Africa who are doing interesting work and are going to be presenting on the use of digital technology in their contexts. So just a bit of a background, which Anna touched on already. Digital health globally promises to revolutionize healthcare delivery, addressing those long-standing health system challenges, but really must be developed and implemented successfully across systems to make sure that individual patients and communities are really getting those benefits. Digital health technology is widely used across primary healthcare in Sub-Saharan Africa, and we've only seen that grow since the COVID-19 pandemic. And we really started this project with the basis that it's critical to develop further evidence that can be utilized by all stakeholders in this area, mindful of very specific contextual realities, to enable further scale up and again, maximize benefits to patients and to health systems. So I, on this slide, just show the sort of scope of digital health that we used in our report. So when we're saying digital health, or it could be e-health, we could be talking about telehealth, electronic health records, data-driven technologies, e-prescribing, e-appointments, mHealth, so using those mobile devices, and assisted living, sensors, robots, and all sorts of very sort of advanced and interesting things, all brought together in healthcare to either address healthcare challenges or health challenges themselves. So with that said, just a quick overview of the report that hopefully we will be able to share a link to in the chat if we haven't done so already. but our project aimed to explore the digital solutions currently used in primary healthcare in Sub-Saharan Africa, including the current strengths, weaknesses, opportunities, and threats to further development. And we know, how important primary healthcare is to a strong health system. So I think it's an area we were excited to work in because there's just so much opportunity that has the ability to impact so many patients and communities. And our second aim was to develop a set of recommendations for practice and policy across stakeholder groups to really drive the conversation and actions further into the future. So our team sought Sub-Saharan African-wide participation to develop the evidence base by taking a three-step approach to generate evidence for this report. And that started with a review, assessing current research, reports, policy papers, and other publications on current use, future opportunities for digital health technology in Sub-Saharan Africa. We spoke to a range of experts with diverse views from diverse groups across PHC through one-to-one interviews and a roundtable. So thank you to anyone on the call today that was involved in that. We really appreciated getting to learn from your experiences. And then finally, we developed case studies based on best practice identified from our review of the evidence and from observations that our team undertook of digital health technologies in practice in select case study sites. So with all of that said, I hope everybody will go and review the policy paper, which provides so much interesting observations from those that we spoke to, a real synthesis of information from current research. But I'm not going to spend too much time focusing on that part of the report today, because the main juice and the way that we feel that we're going to drive impact is through the recommendations that we put together as part of the report. So as I mentioned, we split these out into some of the key stakeholders working in digital health in primary healthcare. So it's not a completely inclusive list of stakeholders because there are so many, but we focus on specific groups of individuals and organizations. So the first being government leaders and policymakers. Based on the evidence and our discussions with experts in the area, we felt that the key actions going forward is to ensure basic infrastructure is in place to support digital health innovation in primary healthcare. So one thing we did in the report is try to show best practice examples of where things have really gone well and what we might learn from them. While Sub-Saharan Africa is a huge continent and the regions, even within countries, so diverse, we're not saying that what works one place will work everywhere, but there are certain successes that we think should be celebrated and considered as other individuals, organizations, geographies move to expand in a similar way. So for example, on basic infrastructure, mobile data access in Ghana has been developed through government policies and the enabling of funding pots to do that in recent years. And that's just such a fundamental for being able to support digital health innovation in primary healthcare, being able to access mobile data. Similarly, electricity access and access to the technologies themselves are other areas of basic infrastructure that really should be in place and put in place by government leaders and policymakers so that we can go forward with the digital health. We also noted that governments should establish minimum regulations, including standards for data protection, digital innovation and evaluation. And in doing that, they really will encourage other stakeholders, so everyone from healthcare providers to the developers of digital technologies, to feel confident that they can design and implement and deliver digital health without concerns around whether they're doing the right thing, whether they're following protocols. If that is all very clear, the innovation will come. So then we move on to healthcare providers. And just one recommendation we had here for healthcare providers was to develop a digital health strategy for sustainable use of technologies by healthcare workers over time. So this is all around ensuring that whatever is being implemented is sustainable. The healthcare workers involved in engaging with that technology understand it, are comfortable with it, they feel that it adds value to their work. And so we'll hear a bit more from Living Goods later, but we provided a nice example of using data-driven technologies to incentivize the health workforce in the report. We then turn to non-governmental organizations who obviously have quite a large role in healthcare delivery in Sub-Saharan Africa. Two recommendations here are to seek meaningful collaborative partnerships with local stakeholders to maximize program impact. So it's quite a generic one that could probably be applied to any health projects and programs in Sub-Saharan Africa, but it's even more important in digital technologies because suddenly you have larger number of stakeholders and perhaps a broader range of understandings of what digital health technologies are, how they're used, and the impacts and benefits that they can have to patients, providers, and health systems. We also felt that exploring long-term and sustainable funding models for digital-focused primary healthcare programs and innovations would be essential because they often require a large financial investment, and it's important that we continue to utilize the return on investment over time. And so the shorter term funding models that are often used by non-governmental organizations may not work as successfully in regards to digital. So definitely developing long-term funding models with local stakeholders and trying to understand how that can really provide longevity and security to the process. The next area is researchers and research funders. We have a very nice, simple recommendation there: increase funding for research into digitally enabled primary care. So I think post-pandemic, we're all aware of the role of digital and what it really can do to transform systems. Primary care is an excellent aspect of the healthcare system that digital can feed into. So we just generally believe that increasing funding in this area will be of huge value, particularly in comparison to the more vertical programs where you're focusing on just one disease. Better to focus on the breadth of primary care. We also note that investigating the role of digital technologies in improving continuity of care across the health system and the importance of interoperability are two fundamental areas for researchers to really start to look at. And that's in the spirit of, while digital technologies can be employed exceptionally in primary care, we need to understand how they fit into the wider system and how they can provide a continuous positive patient experience as they move through the entire health system. And interoperability is a real core element of that. And then our final core group is industry. So much of digital technology is not going to be developed in health systems themselves. We must rely on industry and corporate partners to develop the technology. And in that regard, we feel the industry must develop innovations that have the express goal of addressing health inequalities in primary health care. And there are some good examples of that being done in other areas of healthcare. So not something that is impossible or improbable. And we also have noted that it will be essential to adopt user-centered design methodologies in the development of digital technologies for healthcare. So human-centered design methodology and making sure that the technology is ultimately going to work for the individuals who use it. And we say in our report time and again that all stakeholders involved in digital transformation have the obligation and the interest in co-developing these solutions with patients, carers, families, and communities. This is something that we see time and again forgotten or overlooked at the expense of the quality of what is developed and at the expense of how it is implemented and how it's implemented successfully. So gaining insights from patients and patient groups will enable the development of programs and innovations based on really specific patient needs that can ultimately provide greater efficiency, effectiveness, equality, patient-centeredness, safety, and timeliness, and really drive that healthcare innovation that will make a tangible difference. So with that, I will stop sharing, and thank you again, everyone, for joining us.
Thank you so much, Niki, and we are really looking forward to discuss these findings and learning from each other during the Q&A. So without further ado, I'll move into the next section, the next presenter. So we'll have with us today Professor Shabir Moosa. So Shabir was a key element on the production of this report. He's currently a member at large of the executive board of the World Organization of Family Doctors, and he has previously held also a role as executive coordinator of Afro-PHC. As we've mentioned before, Afro-PHC was one of our key partners, a part of this work. So basically, Afro-PHC is a network of leaders across different sectors in the African primary care, and it has a huge representativeness around the continent. So currently, the membership includes 335 people from 64 countries. Most members from Nigeria, South Africa, Kenya, Uganda, Zimbabwe, Ghana, Congo, but much more. So we thought it was really a good partner because it will give us basically the opportunity of link with people from different countries and learn from their experiences. So I'll hand over to Shabir now, who will give us a brief presentation on this topic and also the work of the World Organization of General Practice on the Africa region in what concerns digital health as well. Over to you, Shabir, and thanks for joining us today.
Didn't realize I was muted. I'm sitting in a community health center in South Africa, which is behind me. And I had to steal a few moments to be able to talk to you. As mentioned, I played a role in the Afro-PHC, and I think that that work that's been done actually came off that. Mercy Wanjala, who's the current executive coordinator, will share a little bit more about the Afro-PHC and some insights. I think in the World Organization of Family Doctors, there is a special interest group on e-health, on digital health. And I think that as family doctors, we are very concerned about the way in which we can get digital health taken more seriously, particularly with a view to getting it being more patient-centered, as our experiences with the patient-doctor experience, but also from an African perspective and a growing international perspective, to enable us as primary care providers to be able to give care not only to patients but to a population, with a strong emphasis on prevention and also patient ownership, so that patient portals actually are part of the way in which we consider care to be provided, and getting patients collaborated with much more strongly. So in terms of the work, and I'll just share this briefly, and I know I have just a few minutes, essentially, I'm very much more involved now in the work being done in South Africa around the rollout of the National Health Insurance, a universal coverage initiative in the country. And essentially, we are realizing that the IT spine is in fact a key element of the rollout of the national health insurance. And I think just for those who are not very familiar, but in South Africa and in globally, the key changes in countries like South Africa, low middle income countries, is to move away from funding, moving from high levels to lower levels through a budget, line item budget, through various levels of bureaucracy, to be moving directly from the fund holder, which tends to be a fund, collecting funds however it does, to then move very much more directly and speedily down to the provider at a very decentralized level. And together with that change in the way in which providers, clinics, etc., have these funds, so do the opportunity arise for private providers to be contracted on the same basis, and funds moving very much more quickly and directly to providers, both public and private, enabling them to be able to manage this in the care of what is generally an empaneled population, paid with capitation or blended capitation systems. In South Africa, the National Department of Health, out of its 44 posts that they've advertised, they are looking at half of them being for IT. And South Africa's really got a lot of opportunity to look at all the cutting edge type of, you might say, IT possibilities that have been raised by practitioners and much more even than is available in Africa. But the big problem is what Niki mentioned is the interoperability challenge. And lots of governments, and even in South Africa, we've been battling for many years without this framework, and everybody comes up with their own project and doesn't speak to each other. So what the National Department of Health has set up is a South African health exchange housed by the CSIR, which is an institute for research in the country, basically having a health information exchange with the Health Standards normative framework that has been just released about a year back, that allows for any new software to be able to speak to each other through that exchange based on a patient identification, which is called a health patient registry system, a health patient registry number. And that is essentially linked to our national home affairs, our, you might say, population registry, which has good biometrics attached to it, and they're going to speak to each other. So that essentially the whole population is registered. And so any of this empanelment and then contracting and then subsequent data collection will be premised on that kind of system. So it really is an important step going forward. I think just to speak to the many possibilities with IT, I think is to build into the industry, saying that now we've got no one national system as the software goes. We've got a national framework with which many systems can speak to each other, which means that the innovation possibilities out there will be unleashed. But what we have to look at is that government needs to be able to deal with not only syntactic interoperability, but semantic interoperability, so that the people in software business are able to figure out what is the actual information field that's required, not just the data talking to each other, systems talking to each other, but what are we actually collecting, and is that uniform, standardized? And I think that is really important. It's almost like getting the HIPAA equivalent in South Africa and perhaps in Africa, which is a real challenge for us going forward. And I think in the work that I've done in the South African, in setting up a model in the Soweto area for Gauteng, we are actually saying that government needs to set out a performance management process in the contracting that actually says an EHR somewhere along the line is a requirement, and that we need to then explore more detailed data requirements that speak to performance, that the industry then has an impetus to respond to. So that means that we have to have a government that not only sets up this kind of internet exchange and sets up ways in which interoperability will function, but to actually paint the picture going forward as where we are going, so that software houses and providers can navigate their way in a collaborative way to say, how do we get the best of IT happening in our setting? So that's my little pitch from South Africa. I hope that's useful, Niki and Anna.
Thank you so much, Shabir. Certainly very useful, and thanks for giving such a comprehensive overview of the challenges, but also the opportunities lying ahead of us. So that's really helpful. So now we finished our introduction session. So hopefully this has given you some context on why we are doing this, or why we did this report as a first piece of work, and the wider context within the Africa region. And I'll now move to our three speakers. So we'll have three different speakers joining us today. The first of them is Dr. Mercy Wanjala. So Mercy was also involved in this report, and she has very recently started a role as executive coordinator of Afro-PHC after Shabir. So I'd invite Mercy to join us and tell us a bit more in detail the role of Afro-PHC and the work that we did together. So over to you, Mercy. Thanks for joining us today.
Thank you very much, and I hope you can hear me.
Yeah, very well, Mercy.
Oh, great. Let me just share my screen. Give me a minute. Good afternoon, everybody. Just a bit about the work that Emily has mentioned and also Niki has shared. We did a series of interviews and a series of focus group discussions around what digital health looks like in Africa. And I think it was a very good session and also practice for Afro-PHC to just see what the frontline healthcare workers in Africa are facing in terms of either having access to digital health or having no access. And of course, one interesting fact that we came across is there's good mobile phone coverage from most of the people who participated. But now in terms of how that is used and leveraged to develop primary healthcare and also just increase access to primary healthcare at in different countries across the region has been what we realized is a challenge. And also in terms of what kind of technology is needed, what kind of technology should be used, how it should be used. So those are some of the issues that were coming up during that discussion. And like Niki said, you can go and read the final report on what we found in terms of what is used in Africa in terms of digital health technology, especially at the primary healthcare level, some of the challenges and some of the opportunities and threats that we have in terms of the use of digital health in Africa. So I'm just going to speak a bit about what Afro-PHC is doing in terms of leveraging digital health technology, not just digital health technology, to advocate for and strengthen and build primary healthcare within the continent. So I'm going to start with one of the recent projects that we did around policy and advocacy. We have been developing a policy framework around building PHC teams for UHC in Africa for the better part of a year now with the support of PHCPI grant. And one of the things that we did was have a primary healthcare video competition where we have participants across Africa with scripted videos on the various content that we have on the primary healthcare framework that we've developed. So there's a link here to one of the videos. I'll share. The slides will be shared later, and you can see some of those videos. So one of the things that really came out from these videos is, one, we got to interact with a lot of Afro-PHC members. We got to see what they're doing in terms of primary healthcare and also what their primary healthcare settings look like, which you can see also in the videos. So this is one of the ways that Afro-PHC is currently leveraging technology to advocate for policy in Africa. So another way that we are leveraging the use of technology is in research, because we realize that research is needed to develop primary healthcare in Africa so that we can have evidence-based strategies and policies. So all of us know that Zoom has been quite an important platform in connecting people. And for us at Afro-PHC, we have used it to connect mentors and mentees across the region so that we can have the more experienced researchers in primary healthcare mentoring young doctors and young healthcare professionals in research for primary healthcare. And this is just one of the announcements that we are having for the sessions we usually have every Thursday. And we're also in the process of recruiting again for our next series. Then the other way we're trying to leverage technology is in building capacity in leadership and governance. Because one of my favorite quotes when it comes to leadership is, of course, everything rises and falls on leadership. And as we've been doing consultative workshops across the region and developing the policy framework, one of the things that we realized was that most people were complaining about the capacity of leadership within the healthcare space, leadership within the healthcare facility, and especially the primary healthcare facility. Do we know how to manage our funds and human resources? We do not know that. And so one of the things that Afro-PHC has done is obviously to partner with WONCA Africa and Amref Health Africa, who have a digital platform for different courses in order to facilitate the leadership and management in health systems governance and strengthening for all our members. So this is something that we have been doing, and we plan to restart it again this year for the second half of the year. So you can see that technology is really important even in trying to build capacity, because without capacity in leadership and governance, we are not really able to build primary healthcare systems in the region. This has become a very common platform, that is WhatsApp, and we are also using it to try and reach out to the people who are Afro-PHC, who are healthcare workers at the front line. So we have developed 6 chapters for Afro-PHC, all the way from Central Africa to also Lusophone Africa and Arabic Africa, just so that we can bring Afro-PHC members together. So Afro-PHC members are open to choose which platform works for them, for their specific region, and also by language. So this is us trying to create a community of practice in Africa around primary healthcare, not for high-level meetings, not for high-level discussions, but for discussions around what is happening at the primary healthcare level at the front line in African PHC. So that is just some of what I wanted to highlight in terms of how you can leverage digital health as well in the advocacy and policy space, because when we think of digital technology and leveraging it in the healthcare space, we only think about at the point of giving care between you and the patient, between you and the community, clinical decision support systems that we use in various hospitals, electronic medical records. But as you can see, we can leverage technology not only when we're seeing the patient, not only within the systems, but also to build capacity, to create research networks, to create practice networks within the continent, and also for knowledge and experience sharing and collaboration. Because within those groups, as people are talking, you find that in 2 different countries or 3 different countries, you're doing the same kind of research. You can actually collaborate and compare what your findings are, and even strengthen your evidence base. So you can go for more information to info@afrophc.org and see what more we are doing in that space. And also in July, we will be finally launching our policy document on building primary healthcare teams for UHC in Africa, which is also a digital document that you can access to help you with your advocacy efforts in primary healthcare, and also to just think around the policy issues that are required in order to strengthen PHC in Africa. And with that, I want to thank you for your audience and hand it back to Anna. Thank you, Anna.
Thank you so much, Mercy. And it was really interesting because you've touched in a lot of the case studies that I'm sure our audience is going to be interested in discussing as well. So thank you so much for the overview that you provided. And I'll move into our next speaker. And we have discussed in the introduction as well, it's really important in whatever aspect of digital health intervention we are considering, it's really important to make sure that different stakeholders are involved, because all of us play a different role and can contribute synergically to the implementation. So the next speaker will represent the perspective of NGOs, and in this case is a particular NGO which is called Living Goods, primarily based in East Africa, Uganda and Kenya, which is going to give us also the perspective and reality of another Africa region. And Living Goods basically works with governments and partners and tries to leverage smart mobile technology, improve performance and the cost effectiveness in order to deliver high quality care. So I'll hand over now then to Priscillah. Thank you so much for joining us, Priscillah, and she's going to share the experience of Living Goods and the role as digital health manager as part of that NGO. Over to you, Priscillah.
Yeah, thank you so much, Anna. Let me share my screen, and I'm really honored to be presenting to you all today. Just a minute. All right, like Anna has mentioned, I'm Priscillah Balirwa, Digital Health Manager with Living Goods. And Living Goods is a non-government organization that, supports governments in East Africa, specifically, Uganda, Kenya, but we're also in West Africa, in Burkina Faso. And our focus is to, support governments in strengthening our community health systems. And our mission is to, save lives by supporting digitally empowered community health workers, so as to get care to those that need it. So our vision is to have a world where all families can easily, access. Sorry about that. Where all families can easily access the healthcare they need to survive. So we know that community health workers are part of the communities, and they come in to fill the gap in terms of access to healthcare, given the fact that in Sub-Saharan countries, there is a very limited number of doctors. So that is where the community health workers come in to fill that gap. And these are some of the roles that community health workers play in terms of, are making sure that people at the last mile receive healthcare. So they do a range of, roles from education in terms of disease prevention, but also ensuring immunization promotion, areas around maternal and child health, as well as family planning, following up clients at home in order to ensure that the referral loop is closed, but also they support in terms of assessing illnesses in under fives. So as Living Goods, we have an approach that we use in terms of supporting different governments. And this approach is based on something that we are calling DESK. DESK is, it was approved by WHO, and it is a part of the WHO Community Health Guidelines, but it's also part of the Community Health Impact Coalition principles. And in this approach, the focus is not just on the digital, because oftentimes we see governments just focusing on the digital technologies, but we see the need to, compensate these community health workers because they are volunteers. In addition to that, supervising them and, providing that support supervision enables them to deliver quality health care. But also in addition to that, equipping them with the necessary, commodities, like medicines, but also training them and ensuring that they have the right skills to reach out to the communities is also really key. So in our approach, we really ensure government resilient community health. So ensuring that our government is leading, because that directly ties into the aspect of, our sustainability. But we also drive impacts through data-driven community health across the countries that we are supporting. And then for new countries that we usually go into, there is usually a clear blueprint, of course, following lessons that we have learned over the 15 years of supporting our government. So while we are, supporting our governments in the different countries, and again, this is part of our new strategic direction, we ensure that, we increase high quality digitally enabled healthcare, like I have mentioned, through equipping these community health workers with decision support aids, but also most importantly, ensuring that we are contributing towards health impact through, reducing, for instance, child mortality. But also while doing this, we ensure cost effectiveness so as to maximize returns on investments. So just to briefly go over our digital health footprint, as I earlier mentioned, we are in Uganda, Kenya, as well as West Africa in Burkina Faso. And really the key role we play is thought leadership role, being that technical assistance partner for Ministry of Health, and sharing lessons from over 15 years of our experience to ensure that our government is adopting best practices. And as we support governments, we ensure that they are leading, again, just to emphasize that for purposes of sustainability, but also across these countries, we partner with the various other partners that are supporting government so as to ensure that we are, harmonizing our efforts. So just to briefly speak about the work we are doing in Kenya with the government. So we are the lead partner with the Kenyan government in terms of, deploying what they call the electronic community health information system. So this is a standardized, tool that is used by community health workers in Kenya. It is, based on a global good, a platform called the Community Health Toolkit, developed by our partner Medic. And currently we are in conversations with our different departments at our Ministry of Health, because again, it's really important to ensure that all the different aspects are catered for, from maternal and child health to health promotion to disease surveillance, as well as other areas. So we are partnering with those different organizations, JSI, there's funding from UNICEF, among others. Then in Uganda, still we are supporting Ministry of Health as a technical assistance leader partner in terms of deploying the electronic community health information system. So again, this is not so much different from Kenya. It is also based on global good platforms, but in Uganda, the government is taking an approach to, multiple platforms, one system approach, so as to have, a backup plan. When it comes to these digital technologies, sometimes they can't fail at scale. So the Ugandan government is taking that approach, but ensuring that these are really integrated. Oh, okay. So similar to Burkina Faso, that's what we are doing. Maybe to just quickly run over the key core functionalities of these tools. They're not just data collection tools, they are decision aids because, as we know, the community health workers we support have very limited education levels. So it is important for these tools to aid them in their decisions. They also enable them with task management, but they also provide, some analytics to keep track of the targets they are achieving along the way. Then again, there are supervision dashboards for their supervisors to track them as they deliver care in the communities and therefore be able to provide targeted support. So in terms of the key facilitators, and you can look at this later, the key facilitators have been, categorized into 3 buckets. The community health program, there you want to ensure that the community health workers are trained, they have the right skill sets, they are collecting the right data. Then when it comes to the enabling environment, issues around policy, leadership, and governance are very key, but also technical infrastructure. Then the quality of the existing digital tools and the functionalities. Yes. Finally, as I wind up, In terms of key barriers, as you know, in low and middle income countries, there is usually a limited access to power, and these devices that we give to the community health workers need to be charged, but also issues around personnel to support the platforms, as well as issues to do with network coverage. So these are some of the key barriers that come into play in terms of deploying these solutions for community health workers. Thank you so much, Lisa.
Thank you
Sorry,
so much.
it took a lot of time. Yeah.
There's so much there that would certainly be great to have more time, and hopefully we can follow up after. So I'll now move into our third and last speaker. We mentioned about the importance of talking about different with different stakeholders. We talked about with AfroPHC as a network. We talked from an NGO perspective, and we'll now talk from an academic perspective. So it's my pleasure to introduce Dr. Nana Kwame Boateng, who's a senior lecturer at Kwame University of Science and Technology in Uganda. Over to you, Dr. Nana Kwame Boateng, and we'll move into Q&As just after.
Well, thank you very much, Anna, and it's a privilege to be with you today. So I'm from Ghana, actually, just for correction, and I'm also the current secretary of World Organization of Family Doctors. I've worked closely with Prof. Shabir and Mercy, and they've set a good tone for my presentation. So I'll be talking to you about digital health technology in public health facilities in Ghana. This will be the outline of my presentation. So my approach to this presentation is to basically give you common challenges that are in Ghana, and I'm sure other parts of Africa. And when I talk about the challenge, I will present to you some of the innovations that have been done. And then finally, I'll end with the challenges that we are facing with the new innovations. Our common challenge is when you come to most of our public hospitals, you see a typical outpatient department crowded like this. And the main problem is the fact that we don't have a functional patient appointment scheduling system at most of our facilities. There's a long waiting time. There's poor supervision in terms of workers reporting late and sometimes not even giving off their best, poor attitude. And then there's also not a very structured coordination at the OPD. Sometimes they lack directional signs to be able to direct patients, and this causes delays at the OPD, leading to overcrowding. Another common challenge has to do with our medical records system. Quite a number of the facilities still use paper-based records, and as you can see, it becomes very cumbersome when it comes to retrieving patients' medical records. Sometimes data is lost, and it becomes difficult when you need that data for research purposes or for critical decision-making within the health space. And then also with time, the space becomes limited. And so archiving of the documents becomes difficult. And sometimes you have to burn some of the documents, leading to loss of critical patient data. So in line with this and the challenge that we've had, long waiting time, paper-based records, then has come the innovation of the electronic medical records. And in Ghana, there are various types. So we currently have the Lightwave Health Information Management System, which is LIMS. And this has been implemented across facilities owned by the Ministry of Health, and then facilities that are owned, some facilities owned by the Ghana Health Service. And the Ghana Health Service also has the District Health Information Management System. Currently, these are working in terms of reducing patient waiting time, making it possible for us to be able to retrieve records. But there's still teething challenges, and I'll share some of them with you. In spite of the LIMS and then the DIMS, there are also individual facilities that have their own electronic medical records that are different from what LIMS is available on LIMS and what is available on DIMS. And some of these are available in private facilities as well as public facilities. Now, apart from the waiting time, which is a common challenge in most of the facilities, now another common challenge has to do with accessibility to essential medications, vaccines, and blood products. And particularly because in most countries in Ghana and across Africa, you find that there's poor road network. So people having access to these essential medications become a problem. Sometimes the medications expire. Even getting blood products to be able to give to bleeding women during pregnancy, and then people who need blood also becomes a challenge. And sometimes you can have a facility having a stock of blood and others also lacking. And then one typical challenge we have is an inefficient fiscal address system. So you may not be able to tell that this person lives on 36 Okodie Road because some of the address systems are not good. So accessing these facilities become a challenge. So the innovation here has been the government of Ghana has introduced the use of drones or unmanned aerial vehicle. In Ghana, we started first with the distribution of blood products to essential areas. So some inaccessible areas, now you can fly a drone to supply blood products to them. And then vaccines, actually, there was some shortage of vaccines in some communities and drones were used to transport these to them. And even recently, when it came to COVID-19, in terms of testing, there was drones were used to be able to pick samples of suspected COVID-19 patients and transported them to testing sites. And that reduced a lot of waiting time. And Ghana is proud to currently pride itself in having the largest aerial logistic delivery network in the world. And we started the drone facility as second to Rwanda, and I know it's been implemented in Kenya as well. But currently, Ghana has about 6 sites where drones are being used to transport critical medicines, vaccines, and then blood products. And then based on this, we published a paper on the use of drones to transport suspected COVID-19 samples. And the key findings of this paper was that a total of 2,537 COVID-19 suspected samples were received and then transported to testing sites. And this covered 10 districts. And we were able to reduce significantly the transport time of these suspected samples from 117 minutes to 39 minutes in terms of the sample transport. And that was quite significant. Now, another common challenge that we face, and I'll share with the innovation with you, has to do with difficulties in identifying pharmacies with particular medication. So sometimes a clinician can write a prescription for a patient, and the patient will be roaming through town to get the medication. So the government of Ghana has come up with an e-prescription platform that essentially looks at a prescriber uploading a prescription onto that platform, and then being able to search on the platform to know that, for instance, if he has prescribed anti-malaria for a patient, a particular one, he can search and then know which pharmacy within that enclave that may have that particular product, and then can direct the patient to go there. Or the patient can also make the request, make payment on the mobile phone, and the medication will be transported to that patient, which is home based. So this is the e-pharmacy that has also been implemented. And then in the area of research, we are involved in a number of digital technology research. One is, I think Priscillah mentioned it in Uganda, where community health workers are very important. So this research looks at giving mobile phones to community health workers to be able to detect some diseases, particularly patients with lymphedema or lymphatic filariasis or have hydrocele, so that they can report to the health facilities for help. And another one we are currently doing is a randomized controlled trial that looks at using phone-based intervention by nurses to guide patients with stroke to see whether the nurse intervention using mobile phone can reduce a stroke-related death and then enhance survival of our patients with stroke. Now, what are the major challenges? I've talked to you about the main common challenges that we have. I've spoken to you about the innovations. And the challenges that have been identified are not different from most challenges as espoused by Prof. Shabir, by Mercy, and then by Priscillah. And a key part has to do with the initiation challenges, where most facilities perceive that implementing digital health technology is expensive. And so they become reluctant to start it. And then in Ghana, we have what we call the BBC generation. The BBC generation refers to those who were born before the age of computer. And these people, sometimes it's very difficult to introduce them to technology because they will tell you that we are not familiar with it. That's the BBC generation. And then also sometimes in initiation, there is not enough stakeholder engagement. So having people buy in and then accept the new technology becomes a problem. And then sometimes we are in a hurry to start the innovation that we do not do comprehensive training. And so there are challenges when it comes to initiation. The other arm of the challenges has to do with operational challenges, where internet. I'm joining you now with 2 devices because I don't know which of my devices will be stable when it comes to internet or electricity sources. And then sometimes our data, we do not back them up. So sometimes it becomes difficult retrieving the same data that we may have inputted. So some of them do not have backup system. And then Prof. Shabir alluded to the fact that our digital records system are isolated and there's no integration. So you don't have one system speaking to the other, and that becomes a problem. Finally, the other challenge has to do with maintenance and then sustainability of what we implement. So in conclusion, I've shared with you the fact that there have been significant innovations in terms of digital health technology. Challenges exist, but we can all agree that digital technology is the way to go. But we shouldn't forget the fact that we should not allow digital technology to replace the very critical and important doctor-patient or healthcare worker-patient relationship, so that we still keep that. And I'm very grateful for your attention. And Anna, please take over. Thank you very much.
Thank you so much, Kwame. Really interesting to know more about specific examples of your work and research, and hopefully the audience also found it helpful. I certainly did. So thank you to the 3 of you actually for joining and for sharing your experience. As I mentioned before, our report tries to provide an overview of the landscape, obviously acknowledging that there's much more to be done and that we need to look at local realities, local challenges across the continent. So I would now invite all our panelists to turn the cameras on, please, if you don't mind. And we'd be very happy to discuss and to hear your questions and eventually come up together with some ideas for future research, for needs for future innovation. If you'd like to, if you have any specific questions, just feel free to write them on the Q&A. If any of those have resonated with our local realities and with the challenges that they're also facing, or on the other hand, if there's any other things that we should address together as future research. So we do have a question here from Melanie Lays. I'm just going to share it out loud. So it's a question for Dr. Boateng. So Melanie is asking, what has been the biggest challenge of implementing the drone program that you just mentioned? Would you like to take that one?
All right, thank you. Well, the biggest challenge had to do with political buy-in. So it was initiated by the government of Ghana. And then when it was started, people thought that it was too ambitious and that we have other problems within the healthcare system that we should be paying attention to. So when it was started, we had people opposing it because they thought that it was a waste of money. But other than that, once the initiation started, it's been well embraced and it's been fantastic. So the major challenge had to do with the political opposition. Thank you. Over.
Thank you so much, Kwame. And I was just following up on Melanie's question as well. What do you think are the challenges for to scale up the intervention and eventually to expand it to other contexts, other countries in the Sub-Saharan Africa region? Do you have any thoughts on that?
Yeah, I think it's essential that it is scaled up because, as I mentioned to you, Rwanda started it and Ghana picked it up. Mercy can confirm, I think in Kenya, from my reading, it's also been piloted in Kenya. So if it is done across Africa, then the inaccessibility of roads, travel challenges and all that, we'll be able to transport essential medicines, especially within regions, West Africa, East Africa, or South Africa. So I think it's important it's scaled up to across African countries. Thank you, Anna.
Sorry. So I'll just have a final question here, just also conscious that we're running a little bit late, which is a question, and that might be for you, Niki, as leading author. What do you think are the main priorities moving forward from a research perspective? So what should be our next steps?
Sorry, muted. As I mentioned during my introduction to the report, the conversations that we had with the individuals we spoke to across Sub-Saharan Africa identified quite a few areas of research focused. One was around the idea of interoperability, how that works on the ground and in practice, and how that will connect innovations in primary care to other aspects of the health system. So I think that would be my answer if I could have just one priority. But I think also, personally speaking, we see a lot of diversity in terms of equality and access to digital technologies. So I think a key area for research and investigation is how we can develop and implement technologies that can be accessed and utilized by everyone that they're intended for. So whether that's at a national level, right the way down to a local level, we need to make sure that we're not developing and implementing technologies that are leaving individuals and communities behind.
Thank you so much, Niki. I'm conscious that we are running late, so I have a few questions here, but I'll just pick up one more. And I might, well, leave it open maybe for Mercy, potentially. It's a really important one. So we have one attendant asking that is curious to hear, how do we ensure digital technologies don't lead to increased inequalities in health? It's the 1 million question always.
I think that's a very pertinent question, because one of the things that you'll read in the report is the issue that other areas, and even like Dr. Kwame has mentioned, there are areas that do not even have connectivity in terms of mobile connectivity. So that equity lens has to be applied throughout. When you're thinking of a technology, think about everyone, including the people that need to be covered by it. Because most of the time when we think about starting and rolling out digital technologies, we think only of urban areas, people who already have access. So I would recommend that you always have a vertical equity lens, meaning you meet people according to their need. So if you go somewhere and you want to roll out an intervention, they don't have mobile phone, maybe technology, they don't have technology, they don't have connectivity, they don't have electricity, then that means your innovation in that particular area will cost more. And you have to accept that it will cost more, and you have to be willing to invest that more. That is the only way to approach it, to ensure that you do not increase inequalities as you're trying to roll out digital technologies, especially in Africa and at the primary healthcare level. Thank you.
Thank you so much, Mercy. I'm afraid that we won't have time to ask more questions. So for those that have answered questions and we couldn't answer them now, please feel free to reach out for us. To reach out by email. We are very keen to receive feedback to try to improve these results, but also to think together which would be the next key steps, and to establish partnerships with local organizations and local partners to do this in a way that's meaningful, inclusive, and as diverse as possible. So thanks everyone for joining the webinar. Thanks to our panelists and to our co-authors, and also to our participants. We'll be sharing the recording of the session with the slides later, as you can see on the chat, and the report can be read on our website. So thank you so much for joining us today, and hope you have a nice rest of day, afternoon, or evening. Bye-bye. Thanks for joining us today.